Why you don't need to panic about the new coronavirus. The new coronavirus continues to spread with more than 24,000 cases in China and nearly 200 cases reported in other countries. The outbreak is serious, but if you're living in the United States, the odds are that the everyday flu is a much more serious risk to your health. At this point, the seasonal flu carries much greater odds of killing you while in the United States than the novel coronavirus recently identified in Wuhan, China. To date, the number of deaths due to the new coronavirus in China are 564, according to the latest report from the New York Times. Additionally, 2 people outside of China have died from the disease, one in Hong Kong and one in the Philippines. A new viral outbreak is scary, but it's important to remember that the United States has been preparing to combat such an outbreak. While reports find China mishandled the 2002 SARS epidemic, and may have been delayed in recognizing the seriousness of this new outbreak, the United States is unlikely to have the same issues. Experts emphasize that this coronavirus is at this point less dangerous than the SARS epidemic, which also originated in China. Isolation and quarantine are 2 public health strategies that can help prevent the spread of a highly contagious illness. These strategies help keep those who are sick or may have been exposed to a contagious illness away from people who haven't been exposed. The viral outbreak is still in the early stages and there's potential for it to mutate or for deaths to be undercounted at this early stage. But at this point the death rate for the new coronavirus appears to be around 2%, far less than SARS at about 10%. Although the new virus can infect people of any age, older people and those with asthma, diabetes, or heart disease appear to be most vulnerable to potentially life-threatening illness with this virus, according to the World Health Organization (WHO). The CDC reports that the immediate risk of this virus to the American public is considered low at this time. But they also emphasize that everyone can do their part to help them respond to this health threat. This includes being vaccinated for the flu, and taking normal preventive trusted source actions to stop the spread of germs, like frequent hand washing, avoiding close contact with sick people, and staying home when you're sick. Extensive news coverage of the new coronavirus outbreak can make the situation seem much worse than it actually is. While the infection is serious, the influenza virus still causes far more illness and death worldwide. Experts also emphasize that this outbreak is significantly less dangerous than previous coronavirus epidemics like SARS and MERS. That's it for today. See you around in the next video. Please like and subscribe.